Do you have gap teeth and wonder why that's the case? Are you looking to fix your appearance and want to know what your options are and the process for how that would happen? Well, you're in luck, because that's what we're going to talk about in this video. Hi, I'm Dr. Brett Langston. I'm a prosthodontist. I'm the director of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth. That'd be sweet. Play some music. Have a little character dance across the screen. I like it. So a gap tooth smile, or the appearance of lots of space in your smile, is basically caused for one of two reasons. Either you have correctly sized teeth, but they're just not in the right location, so they're moved around and you see those spaces, or you have small teeth, which gives the appearance of lots of extra space in your mouth. These are two kind of separate reasons why, and we treat them differently. So if you have regular sized teeth, but they're just spaced and are not in the right location, we have two options to fix that. Option one is orthodontics, which is basically moving the tooth into the right location. And we can do this one of two ways. There's conventional orthodontics, which is where generally you have an orthodontist bracket and band the teeth, the metal, the railroad tracks where they put wires on there. And a lot of times this is really good when you have some pretty significant spaces and we need to move the teeth. A lot of the teeth move around a lot to kind of get them lined up perfectly. The other option is something you've probably heard of, either called Invisalign or Sure Smile or clear braces, something along those lines. That's something we offer in our office. And basically what that is, it's a series of invisible trays or aligners that you wear for 2 weeks at a time to help kind of slowly move those teeth into position. If you're wondering about that process, it's a really cool thing. We do it a lot. The majority of the time, as we age, people tend to notice that their bottom front teeth will start to fold in and creep in and get kind of overlapping. And while that's an aesthetic concern, it can also be a functional concern, because as your teeth shift and move, now they're hitting in kind of off angles, and we see a lot of chipping, we see a lot of breaking, a lot of fractures on those bottom front teeth and the back sides of top front teeth as well. The Invisalign process, or Sure Smile process, is a great way to kind of slowly upright those teeth, move them back into the right position so you're functionally protecting the teeth, and also it gives you an aesthetic appeal of everything lined up correctly with no spaces. So the way that we do Invisalign in our practice, you come in for an evaluation. It's basically a records appointment. You'll sit down, we'll do pictures, we'll do radiographs, we'll do intraoral scans, and then basically I sit down with an orthodontist and we plan out your whole case from start to finish. We'll have you come back, we'll sit down, we'll actually put your teeth on the big screen, and I'll show you what we've planned out as far as how many trays it will take, how long it will take, and you can actually see your teeth move into the position we design. It's a really cool thing, and it helps you kind of envision where we're going with the system. So the Invisalign, basically, these are clear trays that you put in and you wear them pretty much 23 hours a day. The only time you take them out is when you're eating or brushing your teeth. But the advantage of these is it's a slow process that puts pressure on. It's a controlled pressure that moves those teeth and gets them aligned where we want. Long story short, whether you do conventional braces or the clear braces, the goal is to kind of shift those teeth slowly and move them into place so that when we're done with treatment, everything is lined up and everything is perfect. And regardless of what type of orthodontics you do, you definitely need to have a nighttime retainer made. And that's going to prevent those teeth from moving and kind of shifting back, because the body is very stubborn. It wants to put teeth right back where you left them. And so if you don't have something to retain those teeth, they're going to shift back. And I think a lot of us see that when we had orthodontics in middle school or high school, and now we're in our 30s, 40s, 50s, and those teeth have shifted and moved right back. So it's a great option we have to close that gap. The other option we have, if you have regular teeth, but there's just the spaces in between them, they're not in the right spot, is fixed, which basically means we do crown and bridge work to give the appearance of the teeth being in the right place. This is a great option when you don't want to do orthodontics, because orthodontics, unfortunately, takes time. Most orthodontic cases take between 16 to 24 months. So you're looking at 1.5 to 2 years to really slowly move those teeth into place. So if you're unhappy with the appearance of your teeth, whether it's shape or size or location, doing crowns and bridges, we can actually camouflage that and give the appearance of all the teeth in the right places without any gaps. So orthodontics, you may be thinking, well, I'm not a middle schooler, I can't do orthodontics, but that's totally not true. A majority of our patients are actually in that 50, 60, 70 age range, and they're just noticing that usually it's the bottom front teeth are starting to get a little crowded, starting to get a little bit unaesthetic. And so that's a great time. Generally, we can get those teeth back in line, like I said, in about 12 to 18 months. It's not as simple as just uprighting these bottom front teeth. A lot of times you have to look at the whole mouth and make sure we might have to adjust the top teeth some to make room for everything. So again, come in, see us, we'll do a workup, and we can kind of sit down with you and evaluate if it's right for you. So the other reason that you might have a gap tooth smile is if you have just small teeth. Whether that can be from just the anatomy is small, altered eruption, you have a gummy smile. These are all things that can cause the appearance of lots of extra space in the mouth. You can do orthodontics, but if the teeth are too small, it's not going to give you the end result that you want, because just bringing them together is going to still have that, it's not going to be an aesthetic look. So in order to address that, we usually need to do something, whether it's veneers or crowns, that we can cover those teeth up and give the size and the appearance that we're looking for. Sometimes we do have to work with our periodontal colleagues on that, because if the tissue's in the way, sometimes we need to modify the tissue and bone so we can kind of create a good backdrop for the right size teeth. These are all great cases. We love doing them. The results are always phenomenal, but it does take a lot of planning, and so it's something we want to come in and sit down with you. We would do a customized wax up so we can kind of get a vision of where our end goal is, because it's a big change to go from small teeth with lots of space to a mouthful of teeth, and we want to make sure we do it right for you. Altered eruption is when the teeth don't come all the way out into the mouth. So basically you're left with shorter teeth, the appearance of shorter teeth, because maybe 2/3 of the tooth is visible, but 1/3 of the tooth is behind the gum line. And so basically you've got the right size teeth, but we just can't see them. So at that point, a periodontal or a gum surgery would be great to remove that excess tissue and expose the natural teeth that are there. So if your gap tooth smile is because you're missing teeth, that's a whole nother ballgame, and we've got lots of options for that. So if any of the topics I discussed in this video appeal to you, or you have more questions like what's a dental veneer, what's a dental crown, click on one of these videos and we'll walk you through it. So until next time, I'm Dr. Brett Langston, helping you watch your mouth.